Hi.
Hello.
Hi. I'm Wild Iris. That's my muggle name. Thank you for the introduction. As Floyd said, I spent several years working in mental health facilities. I'm currently completing my master's in nutrition and dietetics, and tonight I will be presenting on the effects of metabolic syndrome, or of medical nutrition therapy on metabolic syndrome in people prescribed antipsychotic drugs. So, individuals taking antipsychotics are typically diagnosed with either schizophrenia or schizoaffective disorder, which is characterized by symptoms of schizophrenia with the added symptoms of a mood disorder, such as major depression. Antipsychotic drugs are prescribed to control the visual and auditory hallucinations and are generally effective in doing so. The most well-known and well-researched antipsychotic is olanzapine, which can be taken by a daily oral tablet or weekly injection. Metabolic syndrome is a cluster of non-communicable diseases, including high blood pressure, elevated cholesterol and blood glucose levels, and excess fat around the waist, that increase one's risk for heart disease, diabetes, and stroke. Multiple studies published in the past 2 years have found that individuals with a diagnosis of schizophrenia or schizoaffective disorder are twice as likely to develop metabolic syndrome than the general population, and these figures are higher in people taking antipsychotic drugs. One explanation as to why antipsychotic drugs are more likely, or people taking antipsychotic drugs are more likely to develop metabolic syndrome, is that the symptoms of a psychological or mood disorder make it more difficult to keep up a daily exercise routine and to maintain a well-balanced diet. Another explanation is that antipsychotics bind to the same receptors as leptin, which is a weight-regulating satiety hormone, and because the release of leptin is interrupted, the hypothalamus is unable to receive satiety signals. One meta-analysis evaluated the effectiveness of different approaches to treating metabolic syndrome in this population and found that overall treatments were more effective when combined than utilized individually. The analysis found that pharmacological interventions, such as weight loss drugs, could be helpful for some initial weight loss, but were generally not effective in fostering the lifestyle changes for long-term weight loss maintenance, and they also had very little effect on lipid profile improvements. Behavioral interventions, such as cognitive behavioral therapy, were markedly more effective in maintaining weight loss and reducing symptoms of metabolic syndrome, especially when combined with a nutrition intervention, such as individual counseling or an education group. Medical nutrition therapy is an individualized approach intended to address medical conditions and lessen the development of complications of diseases that are worsened by an unbalanced diet. In medical nutrition therapy, a patient works with a registered dietitian under the supervision of a physician. They engage in the nutrition care process, which is an individual assessment, diagnosis, intervention, monitoring, and evaluation. And together, the RD and the patient develop health goals and an individualized diet plan. A study out of the VA hospital published in 2017 assigned patients taking antipsychotics to a group receiving nutrition counseling sessions with an RD or a group receiving usual care, which was typically just nutrition-related handouts. Researchers followed up with their patients every 3 months and found that the group receiving medical nutrition therapy showed significantly greater weight loss and improved lipid profiles compared to the group receiving usual care. I'll briefly mention another study, a similar design, which researchers found the group receiving medical nutrition therapy showed a significant reduction in fasting blood glucose levels, and some were able to achieve a normal fasting blood glucose level after the period of 10 months. I read about 10 similar studies that showed extremely similar results that were conducted over the past 5 years. So we know medical nutrition therapy is effective in attenuating metabolic syndrome in this population. So what will the average individual's insurance cover who has schizophrenia or schizoaffective disorder? More than 80% of people with schizophrenia rely on government-issued insurance, and this is Medicaid, Medicare, or a combination of the two. The rest are private insurance for at least 1 day a year or uninsured. The Academy of Nutrition and Dietetics describes that Medicaid does not include medical nutrition therapy under a mandatory service It could be included in the other category of optional services, but that is on a state-by-state basis. Medicare Part B does cover medical nutrition therapy for those who currently have diabetes, currently have kidney disease, or have had a kidney transplant in the last 36 months. The Academy website mentions coverage for diabetes prevention in those who have an elevated body mass index, but the Medicare website does not mention that. The onset of rapid weight gain and health side effects caused by antipsychotic drugs leads some to stop their drug regimen, causing symptom relapse. Health is a huge quality of life factor that shouldn't be compromised because of access to care. Reshaping health coverage to include preventative measures such as medical nutrition therapy addresses the root causes of disease and is ultimately the cheaper option. Thank you, and eat your veggies.